Hi everyone. So we're going to be doing physical development in late adulthood. Only three more sets of slides left to look at these happy smiling faces on this first slide. Late adulthood is the period of life that starts at the age of 65 and it goes until the end of life. So it's our last period of development. This is also a time in life where we often think about what a person's functional age is versus their chronological age. So functional age is generally how well that person is doing in this point in their life and what age they look like, not necessarily what age they are. So you could see somebody who is 65 but is functioning at a much younger age, or somebody who is 65 and functioning at a much older age due to health issues or something else like that. There's no biological measure that can predict the rate of aging. Different people age at different rates. There are probably certain things that factor in, like genetics and how well we take care of our bodies, how much we remain physically active or active mentally. But generally speaking, functional age does not equal chronological age. Um, So I think this must be somebody that Dr. Starling knows because I don't know who this person is, but I thought it was important to keep this slide in here. So I'm assuming that she interviewed somebody named Polly, who's nearly 88. I'm assuming this is a relative of hers, um, but she mentioned that the person has lots of responsibilities. They still go walking every day. They have friends and family that they see often, and that they're good at dealing with their body aging and feel contentment even though this is the last part of their lifespan. So as time goes on, life expectancy has been increasing. We used to see that life expectancy was much younger, and over the past several years, you can see in this chart that it has gone up. This chart's a little old now, dating back to 2011, but the life expectancy rate has continued to go up. There are many reasons for this, part of which are things like we have better health care and we have better resources than we used to, so that helps with the life expectancy. There are variations in life expectancy, and they're often due to things like our heredity and our environment. Um, this is another chart that looks at average healthy life expectancy, and this was taken again, it was in 2010. As far as life expectancy is concerned, individuals that reach the age of 65 seem to be able to look forward to, on average, about 19 more years of life. At earlier ages, life expectancy is greater for older women than for men. Today, the 65 to 69-year-old age group includes 117 women for every 100 men for people age 85 and older. This number climbs, and for people age 85 and older, this number climbs to 210. Even though women outnumber men, we do see that the difference between life expectancy and gender is declining. Um, American newborn girls can expect to live about 5 years longer than a newborn boy, and at age 65, the difference narrows to just 3 years, and at age 85, just 1 year. Over age 100, the gender gap disappears. As far as quality of life is concerned, there are two different things that we use to measure quality of life. The first thing is activities of daily living. These are things people need to do to take care of their basic needs. So being able to shower and dress themselves, being able to feed oneself, those are all considered to be activities of daily living. These are different from another measure of quality of life called instrumental activities of daily living, and these include things about being able to take care of oneself on a higher level, like being able to get to the grocery store and buy food, being able to manage finances, maybe being able to work. Whatever the case may be, these activities of daily living use higher functioning. As people age, it's not uncommon for individuals to decline in their instrumental activities of daily living, but still being able to do their regular ADLs or activities of daily living. Moving on to maximum lifespan, um, we generally see the maximum lifespan right now to be between 70 and 110. Currently, the oldest verified age is who's 122 years old. There's a thought that maybe the maximum lifespan should be increased as our healthcare changes and our abilities to live longer changes. Um, Generally speaking, though, most individuals can reach about 85 to 90 years max. Um, but some scientists do believe that maximum lifespan should be increased. And now for the super exciting physical changes that occur as we age. Our nervous system continues to age as we go through late adulthood. Um, we see that there's a large amount of activities that are affected. Our brain weight declines throughout adulthood. However, brain imaging and after death autopsies show that the brain becomes that the loss becomes even greater starting in our 60s. And by the age of 80, about 5 to 10% of our brain, there's been about a 5 to 10% loss in brain weight. A lot of this is because we see that the myelin coating on our neural fibers is withering. There's also a loss of synapse connections, so neurons aren't connecting to each other as well. More neuron death than we've seen in the past, and also the ventricles within the brain are increasing. So those are the spaces in between the brain. So your brain has those gyri, which are the lumps, and then they have the ventricles or fissures, which are the spaces, and those spaces become wider. Um, Generally speaking, we see that neurons are lost in several areas, but four of the main areas that the neurons are lost are in the prefrontal cortex, which is the part of your brain where you see a lot of your problem solving. The corpus callosum, which is that band of neural fibers between the two halves of your brain that allows your brain halves to communicate with one another. Our cerebellum, which is our motor cortex of our brain, or the motor component of our brain, the neurons decrease there, and the glial cells. However, our brain is able to compensate for these losses. Um, Sorry if there's an awkward pause there. We see that the brain compensates for losses. There's been several studies looking at the brains in older adults. Um, And we see that aging neurons can still form new synapses even after other neurons degenerate. Um, and along with this, we see that there's some evidence that compared with younger adults, older people who do well on memory and other cognitive tasks show a more widely distributed activity across areas of their cerebral cortex, especially in the prefrontal cortex and in regions that mirror active sites. So we see that one way that older adults can compensate for neuron loss is to call in additional brain regions to support cognitive processing. So if one area of the brain is affected, another area of the brain might jump in and try to compensate for the loss. Um, we also see that there are autonomic changes in the autonomic nervous system, which is involved in a lot of life support functions. So this causes a lot of issues with temperature regulation. Adults might have more issues with heat waves and cold spells. They might have reduced tolerance for hot weather or cold weather because they have difficulty regulating temperature. Um, those who are more physically fit have less difficulties with this. We also see that there could be a higher release of stress hormones in the bloodstream in older adults than we saw earlier. And this could be because body tissues are less responsive to hormones over the years. So that might cause some difficulty with different changes in the body. So moving on to sensory systems. As far as vision and hearing impairments, this is a graph looking at the percentage of individuals who report difficulty in late adulthood with both hearing loss or being hearing impaired or visually impaired. We see more difficulty with hearing loss in late adulthood. There's a reduced blood supply, and there's natural cell death in the inner ear, and and along with this, the membranes in the ear stiffen, and this can cause issues in late adulthood. Um, and as hearing declines, people who are older report that they feel lower self-efficacy, they're lonelier, and some even have more depressive symptoms. This can also lead to difficulties socially. Along with this, because there's greater hearing difficulties, we see a decline in speech perception, and this can lead to a big impact on life satisfaction. Because of the hearing loss, it becomes harder for people to detect content and uh, particular features of conversation involving emotion, and this is even worse in noisy settings. We do see some reduced sensitivity to the four basic tastes after the age of 60. We also see some decreasing in smell receptors. Um, because people lose a sense of smell, that can also cause a problem with safety hazards. So, for example, an aging person who can't detect certain smells might not notice if there's gas fumes or smoke or some life threatening situation in their environment. We also see a decline in the immune system and a greater chance of autoimmune responses. Um, So, because of the aging immune system, we might see that people get sick more easily. They have a harder time fighting off illnesses and infections. If they have other health issues, that may cause more problems with them getting over, like other colds and things like that. So, for example, if somebody has a cardiovascular disease or a certain type of cancer, they might have a harder time fighting off something like pneumonia or even something like the flu or a cold. Um, of course, if people take better care of themselves, they tend to do better in these areas. Um, I guess you're supposed to eat these really happy vegetables at the bottom of this page to help your immune system stay strong. I don't know, either that or these vegetables are just mean and they're really happy that people have immune system decline as they get older. As far as sleep is concerned, sorry guys, I'm having a hard time recording tonight. As far as sleep is concerned, those who are older require about as much total sleep as younger adults, which is about 7 hours per night. Um, but people, as they age, have more difficulty with sleep. They have a harder time falling asleep, they have a harder time staying asleep, and they have a harder time sleeping deeply. We see that insomnia affects about half of older adults, at least a few nights per month. And we also see that the timing of sleep changes. So people tend to go to bed a little bit earlier and have an earlier morning awakening. There are changes in our sleep structure, in our brain structures that control sleep. Remember before I said that there's a higher level of stress hormones in the bloodstream, and this tends to alert the central nervous system, and that's partly responsible for this difficulty with sleeping. Um, Men tend to have more sleep disturbances than women until about the age of 70 or 80. There's a few reasons for this. One is having as we age, men have the higher risk of having an enlarged prostate, which can lead to more frequent urination. Um, we also see that men are more prone to having sleep apnea, where breathing ceases for about 10 seconds or longer and causes brief awakenings. Um, and then there's a risk for both males and females for things like restless leg syndrome, which causes people to just feel discomfort when they're trying to sleep. Um, we also see that the more your sleep is affected over time, the more likely you are to have poor sleep even longer. So, if people are fatigued during the day from having bad sleep in the evening, they might end up taking naps, which then affects their sleep cycle even further. One of the issues that can come about because of poor sleep are things like having an increased fall risk or cognitive impairment. People who don't sleep well at night, especially in late adulthood, tend to have slower reaction times and also difficulties with attention and memory. We continue to see changes in physical appearance as we get older, more creasing and wrinkling in the skin, more sagging in the skin as well, um, a higher tendency to look in mirrors and see a younger version of yourself and feel generally depressed that your face is sagging as you look in that reflection. Aging is accelerated by things like being exposed to the sun more frequently. We also see things like long term alcohol use, cigarette smoking, and psychological stress causing more facial changes. Other things that occur in the face as we age, we see that the nose and ears tend to broaden as our cells are deposited on the outer layer of the skeleton. Um, and older adults with a history of poor dental care may have more aging in their teeth with yellowing and cracking. There might be receding gums as well. As our hair follicles under the skin surface die, our hair in the head thins in both males and females, and you might see more likelihood that there's scalp visible. In men with hereditary baldness, follicles do not die but instead begin to produce fine downy hair. We also see other changes in physical appearance. Height continues to decline, especially in women. This is partly due to bone loss and mineral content. Weight generally drops after 60 uh, because of additional loss of lean body mass, which is heavier than the fat that accumulates on the torso. Some individuals are good at adapting to the physical changes that occur for them later in life. Things that can cause prevention of physical changes to occur, making sure that they're making good dietary changes and staying healthy as best they can, continuing to exercise and be active, and things like that can lead to personal control and feeling like you're preventing these changes from occurring. Also, some people learn how to compensate for physical changes. They might do things like use assistive technology, as seen below. They might tend to find ways to cope with their problems in effective ways. For example, using tools that might help them compensate instead of just generally dealing with the aging and physical changes that are occurring. So obviously there are a lot of stereotypes that go along with aging. I'm sure everybody in this class has thought or heard of at least one stereotype of aging. Um, Ideas that you're deteriorating as you're getting older. You're unable to do certain things. Um, you can't hear. You can't see. Um, you're unable to think and do certain things. All of these are, different stereotypes that go along with aging. And unfortunately, these stereotypes lead to prejudice and discrimination in the elderly population, and they can lead to mistreatment as well. Um, People tend to see those who are older in stereotypical ways, even if that person who is aging appears otherwise. Um, and seniors tend to encounter stereotype threat, which then can actually lead to them conforming to different stereotypes. So if they're around these negative stereotypes more often, it can lead to a more intense physiological response. It can lead to um, feelings of loneliness and problems in other ways. So stereotype threat can actually lead to further aging. As far as health, fitness, and disability are concerned, we know that being healthy or trying to be healthy is central to our psychological well being in late adulthood. Those people who tend to stay optimistic and do things for themselves to stay healthy tend to be more psychologically healthy as well. Some factors that involve staying psychologically healthy are things like feeling self efficacious, being optimistic, as I just said, having good nutrition and staying fit through exercise. And also, we see that it's more common in individuals with a higher SES, partly because those who have a higher SES are more likely than lower SES counterparts to seek medical treatment. We also see that it's more common in females to have better psychological well being. And as far as ethnicity is concerned, there's a lot less ethnic variations in health in late adulthood. However, we do see that we do see that SES predicts physical functioning. Specifically in African Americans and Hispanic older people, they're at a greater risk for certain health problems like cardiovascular disease, diabetes, and certain cancers. So we want the average period of diminished vigor before death to decrease. This is called compression of morbidity. Um, Here's another fantastic graph for you guys to look at involving this. As far as sexuality is concerned, survey says that uh, those between 57 and 85 years old have a decline in frequency of sexual activity in late adulthood. This is more common in women than men because women are more likely to not be in a marital or intimate relationship. At the same time, those who have some consider that there's some importance to sex do say that it's very or extremely important. Not quite sure why Dr. Starling included this slide in the presentation, but it's a little bit scandalous. I guess that there have been some articles coming out. I mean, these are from 2011, but that senior sex lives are up, especially in apparently retirement homes. So good for them. As far as arthritis is concerned, we do see that osteoarthritis and rheumatoid arthritis are more um, common as individuals age. I'm not going to go much more into this. We do see an increase in motor vehicle accidents in individuals as they age. They have those in late adulthood have the highest rate of traffic violations than any other group, other than those under the age of 25. The increase in motor vehicle accidents can be in part due to things like visual processing difficulties, a slower reaction time, and declines in selective attention, which is very important when you're driving. We also see an increase in falls as individuals age. Um, and because of difficulties with osteoarthritis and osteoporosis and weakened bones, a lot of these falls can result in serious injury, about 10%. 50% of those over 80 have a fall every year. Um, Obviously, falling can cause a lot of impairment in health. It can cause people to fear falling if they have had a fall, and that can lead to difficulties with psychological well being. And also, people might start to avoid more activities because they're afraid of falling again. Um, and even though those who have active lifestyles may be more likely to have a fall, the health benefits of the activity outweigh the risk of serious injury due to falling. You're actually probably in long term more likely to have a fall if you don't stay physically active than if you do. There's an increase in certain mental disabilities as individuals age, partly due to the age related cell death in the brain. Um, Sometimes, when cell death starts to occur, it can cause structural and chemical abnormalities and lead to serious deterioration of mental and motor function. Sometimes, when people have these issues occur, it can lead to a type of brain impairment called dementia. Dementia is actually an umbrella term for a series of different disorders um, of different types. So there are things like vascular dementia. There are things like Alzheimer's that you hear of. Um, there are other types of dementia as well that can occur. Some are reversible if somebody has proper treatment, but then some dementias are not, such as things that are the dementia that's involved with Parkinson's disease, because there's a deterioration in the subcortical brain regions, and that goes into the cerebral cortex. Also, there are brain abnormalities that occur in things like Alzheimer's disease, and so there is no reversing the difficulties that occur from that type of dementia. Alzheimer's disease and cerebral vascular dementia, which are the two most common types, tend to fall under um, the the type of dementia called cortical dementia. So, as far as Alzheimer's disease is concerned, this is the most common form of dementia, and we see that there are structural and chemical brain deterioration involved in this type of dementia. This leads to changes in thoughts and behaviors. Alzheimer's disease leads to is what accounts for about 60% of all cases of dementia at older ages. Um, and about 8 to 10% of people over age 65 have disorder. Of those over 85, about 45% are affected. De- Oops, I didn't mean to switch slides, sorry. Alzheimer's disease symptoms include things like severe memory problems, personality change, depression, delusions, and speech problems. Um, I'm actually going to see, I had a video that I used to show regarding Alzheimer's disease. It's a very short video. I'm going to see if I can find it and post it with these slides because I think it would be interesting for you guys to watch. It shows the progression of Alzheimer's, how it works in the brain, where it starts, how it ends, and the types of things that are affected over time. So hopefully that will be posted. I will leave a note and an announcement to let you know to watch it if I'm able to find it. So we see some major structural changes in the brain when Alzheimer's occurs. There are two major brain changes. Uh, for one, neurofibrillary tangles start to appear in neurons, and we also see that this type of plaque, called an amyloid plaque, develops outside the neurons. So there are structural changes in and out of the neurons, especially in memory and reasoning areas. Neurofibrillary tangle, sorry, neurofibrillary tangles are bundles of threads that are the product of collapsed neural structures. They contain an abnormal form of a particular protein called tau protein. Amyloid plaques, I'm sorry, I'm having a difficult time speaking right now. Amyloid plaques, which develop outside the neurons, are pretty much, they're like deposits on top of the cell. They're made out of proteins called amyloid, and they're surrounded by clumps of dead nerve and glial cells. So, in some ways, you can kind of look at these things as a type of scar tissue that appears in the brain as we have neuron death in the brain. We always have neurofibrillary tangles and amyloid plaques present in our brain as we age, starting in middle age. However, they're much more abundant in Alzheimer's victims. Um, and as we have this brain change and we see these different structures changing the brain and synapses deteriorate, um, we start to see that the brain volume shrinks. So you can see in this picture an Alzheimer's brain on the left versus a normal brain on the right. There is more, while brain volume shrinks, there's more space between the gyri of the brain, those lumps in the brain. We see a decline in neurotransmitters. We see more neuron death, and generally speaking, the brain tends to have a lot more spaces in it from all of these different things, and that stops the brain from being able to communicate well with itself. So as fissures get larger in the brain, um, those cells that used to be able to talk to each other are no longer close enough to do so. We do see that there are some genetic risks and environmental risks for Alzheimer's. We're still not 100% certain what causes it. Anybody can get Alzheimer's disease. It doesn't affect really one particular population more than another. We do see that those who have a higher education level and keep their brain active tend to be less likely to get Alzheimer's disease. And also things like a healthy Mediterranean diet, so a diet that involves a lot of omega 3s and um, lean proteins like fish and things like olive oil tend to have less of a risk of getting Alzheimer's disease. And of course, having a more active lifestyle can be a protective factor. It's becoming much more common for individuals to need long term care as they get older um, because we have a higher rate of life, a higher lifespan than we used to in the past. People, as they're aging and losing those ADLs and um, instrumental activities of daily living, are having more of a difficult time living on their own, so they need people to help them. Um, and if they don't have a caregiver that they know that they're close to help them, they need another option. Um, so some things that we see is that when people have dementia, they're much more likely to end up in a nursing home. They're also more likely to have a loss of a support network and need something like a nursing home or assisted living. These places for care are very expensive. Most are over $50,000 a year, which is sort of ridiculous because we should be taking care of our aging population. There all are alternatives like home care by somebody in a family member or somebody who comes into the home to help. However, sometimes people get to a point where being in their own homes is no longer safe, and the individual that's there to take care of them, like a family member, like a spouse or another child or a child, just aren't able to do so anymore. Especially in advanced dementia, it can become very hard. Um, and then, of course, there's things like assisted living facilities, which can help. Having helping caregivers around as a person ages is very beneficial. Being well educated and having good coping strategies to deal with how hard it is to help a aging individual is crucial. Also, obviously, having caregiving skills to do so and being able to take respite or take a break is also important. So That's it for the physical component of late adulthood. So we still have two more slide presentations to go with cognitive and emotional. I will be posting those within the next couple days. Um, I know late adulthood's a little dry and it's not very uplifting, so thanks for bearing with me, and I hope you guys are doing great. Thanks.